All right, I think we'll get started. Thanks everybody for being here tonight with us. My name is Andy Gurka. I'm the Director of Student Involvement. And thanks for joining us for our new Spider Summer series. Tonight's session is about student health and our student health insurance requirement here at the university. With us tonight are Keisha Trim, who's our Director of Risk Management, and Dr. Latrina Lemon, who is our Medical Director of our Student Health Center. We're very glad to have both of them here. What we'll do is they both have a very short presentation to tell you a little bit about the topic, and then we will open it up for questions and answers from you all. You can use the little Q&A function at the bottom of your screen and ask any questions that you'd like, and we'll go through and answer them at the end of their presentations. So I will let Keisha go first.
Thank you, Andy. Let me go ahead and share my screen here. Okay, so let's see here. As Andy said, I am Keisha Trim, and I'm the Director of Risk Management and Insurance with the Office of Risk Management here at the university. And one of my responsibilities here at the university is to oversee our student health insurance program. And first and foremost, just going into our requirement here at the university requires all degree-seeking traditional undergraduate students and law students to have health insurance while attending the university. And so for domestic students, you will receive an email at the beginning of the semester, or actually during the summer, letting you know that you can go online and waive out of that requirement to purchase the university's health insurance if you have other health insurance provided through either a parent or a guardian, which most domestic students do have that insurance through those channels. International students are automatically enrolled in the plan by the Office of International Education. And there are a few exceptions that will allow you to get out of purchasing the student health insurance requirement, but those are very few, and you would just work with the Office of International Ed on that if you feel like you qualify due to having other health insurance, US-based health insurance. The enrollment period actually opens May 22nd this year, and it closes September 15th this year. After that time, you must have a qualifying life event in order to enroll in the plan. And those are things such as you've lost health insurance coverage, from a parent's plan, either you've aged out of their plan. A lot of times, especially with graduate students, you turn 26 and then you're no longer eligible for coverage under your parent's plan. So then you can qualify under the student health plan. Or there's sometimes changes in jobs that will prompt you requiring insurance. Also, for our domestic students, or well, all of our students really, if you are studying abroad, while you are abroad, you are not required to purchase the student health plan because it is a US-based health insurance plan. So you can skip enrolling in the plan while you're abroad, studying abroad for, say, the fall semester or spring semester. And then once you return to the United States, you can enroll in the plan. So that would be your qualifying life event as well. So one thing I want to highlight is here at the bottom of the screen. It says students who do not take action by the deadline will be enrolled in the plan automatically in late September. So that means that even if you have health insurance, if you do not go online and let us know that you have insurance and complete your waiver form, you will be enrolled in the plan and you will be charged. Now, the way we operate is that we place the charge for the health insurance on the account in, I think it's in July, the bursar's office places that. So from May through July, all the students who have waived will not see a charge on their student account. However, after July, the students who have not taken action will have that charge placed on their account. And then at that point, you will go online and waive, and then the charge will be removed. After September, you're enrolled in the plan and the charge remains. So it's very important to waive before that September 15th deadline. So an overview of the plan. The insurance company is United Healthcare, and it is a preferred provide organization plan, meaning that you do not need to have a primary care physician in order to seek treatment with a specialist. You can access specialists directly under this plan. The coverage period begins August 1st of this year and goes through July 31st of 2024. The annual cost is $3,004, and that is billed by semester. So if you are enrolled in the plan in the fall, you will be charged $1,502 in the fall and $1,502 in the spring. The rate applies to every student, spouse, and each child under the plan that you decide to enroll in the plan. Now, if you want to enroll a spouse or dependents, you have to pay the carrier directly for those. We only enroll students through the university and pay for students through the university. The plan, of course, provides medical care, all your preventive care, specialist care, hospitalization. We have telehealth medical services, mental health care, telehealth behavioral care is available, prescription drugs, and also travel assistance services. For the travel assistance, for domestic students, if you're traveling more than 100 miles away from home, you can use those travel assistance services. If you are in need of emergency care while you're more than 100 miles away from home, or you have need of other assistance, and there's a flyer on the website that kind of goes into more detail about what those services are. And if you're an international student, you can use those assistance services anywhere in the world, as long as you're not in your home country. Now, one thing I will point out here is that this travel assistance is available for you whenever you're traveling, but if you're traveling for the university under, say, a study abroad program, the university provides you coverage under a separate plan. So this is more so for your personal travel, not your university sponsored travel. There are some financial elements and some cost sharing to the plan. So the deductible is the amount that you will pay for healthcare services before the plan begins to pay. And so you really want to think about this in two ways. You have your in-network amounts and then your out-of-network amounts. And so always in-network is going to be the best way to go, because it's going to be the most cost effective for you. And you really want to stay away from the out-of-network. It's just going to be a lot more expensive. So in network, your deductible is $250 per plan year, and then out of network, $600. Co-insurance is the amount that you pay after the deductible has been met for additional services. Like for instance, if you go and have lab work after your deductible has been met, if you're using an in-network provider, the plan will pay 90%. If you're using an out-of-network lab, the plan will pay 70%. It's important to note that for any preventive care, like your routine physicals, your well woman exam, and I'm sure Dr. Lemon can go into all the other preventive care things, the plan will pay 100% for those things in network. Also for co-pays, these are just flat fees that are not subject to the deductible, but you can just pay this fee and see get certain types of care. So like if you need to see an off-campus provider, so such as a specialist, like a dermatologist off campus, you would just pay $25 for each office visit. You wouldn't have to pay the $250 deductible or pay the co-insurance or be subject to co-insurance for that. It would just be the flat fee. Now, any additional services they provide beyond the office visit would be subject to those deductibles and co-insurance amounts. And then, of course, for urgent care, if you go to any of our little Care Now clinics or Concentra, Patient First, those would be $50 for an urgent care visit. And then, of course, the emergency room is $150 for each visit. Prescription drugs, we have a 3-tier plan, and you see here, these are your co-pays, $10, $20, and $40, depending on the tier of the drug. And there's a full benefits book available online that goes over the different prescription drugs and their tiers if you have questions about any medications you may take currently. There are also other policy terms and conditions. So if that is a concern, I suggest you review that in more detail. So under our plan, the most you will pay out of pocket during the policy year is $6,350 if you are using in-network providers. After that point, you will no longer have any other financial obligations. So that's a good thing to know, because if you were to experience a major medical issue, you know that the sky is not the limit, that you do have a cap on how much you would be responsible for paying. But, and then of course, if you have a family, like a spouse or dependents under the plan, that would be $12,700. But one thing to note is that if you're using out-of-network providers, you see that there is no maximum, no cap on how much you can be charged. So again, it's always in your best interest to use an in-network provider. We also have a couple of other products available through our program. These are not subject to the hard waiver process. They're voluntary dental and vision. And so with our voluntary dental, we have a program set up with Delta Dental of Virginia, and you can go online, and there are 6 different plan options available. I priced it for a 20-year-old in our area, and the plans range from $26 a month to $65 a month. So you would just really need to look at the benefits to see which plan suits your needs. And then just looking at the scope of providers in the area, we have 184 general dentists within 5 miles of campus. So there's, you know, a lot of saturation in the area. Also with our voluntary vision, there are 3 plan options available, which range from $15 to $26 per month, with 27 providers within 5 miles of campus. So some of the resources available to you with more information are, we have a university website. It is studenthealthinsurance.richmond.edu. You can also get there by typing ship.richmond.edu. SHIP stands for Student Health Insurance Plan. And on that website, you can see our insurance requirement by population. So if you have a question later about whether or not you are subject to the insurance requirement, you can go online and look there. You can see our current rates. You can see benefit highlights. There's a FAQ section, and then just more campus resources. And this site is managed by the university. I will say that we are preparing for that May 22nd opening of the hard waiver website. So the website is not quite updated yet with the new rates. So that will be launching closer to May 22nd this year. The other website or other resource for you is rcmdstudentbenefits.com. RCMD is our insurance administrator. They are the insurance broker who helps us plan or purchase this plan for you and offer this plan to you. You'll hear the name Tim Cummins a lot, and it's all on our website because he is our account executive who works with the university and works with students and parents to answer questions and really be a day-to-day contact for this program. So on this website, on RCM&D's website, you can also view SHIP benefit information, and this is where you will go to enroll in or waive the student health insurance plan. There are also links to find a doctor, hospital, or lab, and the prescription drug information that I mentioned is on this website, and you can enroll in the voluntary dental and vision. Now, one thing I will mention, I think I failed to mention earlier about waiving and enrolling. You know, I did tell you that after September 15th, you will be automatically enrolled in the plan. Well, for people who do not have health insurance and they may think, okay, well, that's totally fine. I will just wait until September 15th and I'll automatically be enrolled. One of the things, or one of the benefits of going ahead and enrolling in the plan early is that your coverage will become effective August 1st. And so you won't have to wait until late September, almost October, to access your coverage. So that's almost 2 months into the plan where you will not have access to your coverage if you just wait to be automatically enrolled. Whereas if you go ahead and you know you want the coverage, just go ahead, enroll in the plan, and then you can have your card, your ID card, and you can go get any medical care you may need as of August 1st. So just want to make that point. So some of your contacts, like I said, I'm Keisha Trim in risk management, and I'm your campus resource. So if you have any questions, you always feel free to give me a call or you send me an email, and that's students and parents alike. And I also manage the hard waiver. So if there's ever a question about whether a student is eligible for the SHIP, or if they've waived out of the health insurance plan, or should they, if they have problems accessing the waiver, you can come to me first and I will try to assist you with that. The second person, like I mentioned, is Tim Cummins, our insurance administrator. He also handles waiver questions from the insurance company side and from his standpoint. And he will look at the enrollment for the international students and exceptions for the international students. And he also will handle specific claim assistance. So if you have a claim and you feel that you were overcharged or you're not getting the benefits you thought you were getting, then you can work with Tim and he will look into the claim further for you. And lastly, United Healthcare. This is just their general customer service number. And this is the number you can call if you just have general questions about our benefits or the plan's benefits, claims, finding a provider, and so forth. And you want to speak to someone directly about that. So now I will open it up and answer any questions anyone has. Andy?
Thanks, Keisha. I don't see any questions, but we'll take questions at the end too. So I think we'll switch to Dr. Lemon, who will talk a little bit about student health.
Okay.
Thanks, Keisha.
Mm-hmm. All right, let me share my screen here. Let's see. Okay, there we go. All right, can you see my screen okay?
Yes, we're good.
Okay, thank you, Andy. Again, welcome to everyone this evening. I'm Dr. Latrina Lemon, the Medical Director of the Student Health Center here at University of Richmond. So I'm going to take a few minutes this evening to review overall our Student Health Center services, and then also talk particularly about the health history records, also called pre-health insurance requirements. As far as the Student Health Center services, we are staffed by board-certified physicians, nurse practitioners, registered nurses, and certified medical assistants. We primarily provide a lot of services for acute illness and injury, but we also can manage chronic conditions such as high blood pressure and asthma. We provide a lot of health education to our students and also can perform physical exams, and also for students who may be studying abroad as well. We are an accredited healthcare facility, and we do provide such services such as point of care testing in the office. So for instance, if a student is concerned about getting strep throat, or if they think they may have the flu, we can test them for that in the office. We do perform phlebotomy or lab draw services, but those are sent out to an external facility for processing. We're located in the Wellbeing Center, which for many of you who may have come to tour the campus are familiar. We're located on the second floor above Organic Crush, and we're directly adjacent to the Weinstein Center for Recreation. As far as being seen at the Student Health Center, there is no fee to see a provider at the Student Health Center, but there are fees associated for any lab services we perform. Along with that, we are able to provide certain immunizations, and I'll talk a little bit about what's required as a pre-health insurance requirement for the university. And we are able to prescribe medications. We do not have an on-campus pharmacy, but we are able to prescribe medications electronically to a pharmacy of your choosing, which is done in consultation during the office visit. As you probably learned during many of your campus tours or in some of your new Spider orientation materials, there are several campus shuttle options to be able to get off campus to reach a local pharmacy. One thing to point out, Keisha just talked about the student health insurance requirement. The Student Health Center does not have the ability to bill your medical insurance. We do not collect that information. We do not utilize it for anything within the Student Health Center. But for any services that are provided at the Student Health Center, you can receive an itemized receipt that you can submit to your insurance company to discuss with your insurance company if you're able to be reimbursed for those services. Just a reminder, and of course we'll go over this once you arrive on campus in the fall, the Student Health Center is open Monday through Friday. We're open 8:30 to 4:30. We are closed during university breaks and also in the summer as well. We are currently open only for administrative needs. So as I walk through the health history records, if you do have questions, there are numerous ways to contact us. But also keep in mind the Richmond area, as Keisha mentioned, is home to many healthcare facilities. So if the Student Health Center is closed, there are ways to access care as well. So talking about the health history records, here I just screenshotted how you access our website for the Student Health Center. You can access it from the main University of Richmond webpage, or you can type in healthcenter.richmond.edu. And then once you get to our landing page, you're going to look for the icon that's located here at the bottom, which is your student health portal. The way we communicate health information to students is utilizing a secure student health portal. You'll access that through something you'll learn about called single sign-on, which is a secure method that identifies you as the user of the system. As you'll know from either currently using any type of secure portal, or you'll learn as you start your college journey, that it's important to make sure to protect that information and not share that login with anyone else. Once you click on that link, it'll take you to the health history records process, which I'll talk about here shortly. As far as the pre-entrance health requirements for the University of Richmond does follow the Commonwealth of Virginia's guidelines for institutions of higher learning. Therefore, we have 5 required vaccinations and also 3 specific paperwork that we want you to fill out as well. As far as the 5 required vaccinations, these are tetanus. This could be a Tdap or a TD within the previous 10 years. Measles, mumps, and rubella, also called MMR. Polio vaccination, which many individuals receive during childhood. Meningitis, there's more than one meningitis vaccine. The one that we are looking for is meningitis ACWY. And finally, hepatitis B, which is a series of 3 vaccines. Our requirements are based on the CDC guidelines. So keep in mind, for instance, hepatitis B is routinely a series of 3 shots, and we do expect all 3 shots to be documented from your healthcare provider. When you're filling out the forms, it is a 2-step process. So once you log into the portal, it will walk you through and say, number 1, please enter the dates for those vaccinations for the 5 required vaccines. You will need to manually enter those dates because that is how our computer system can then mark you as compliant or not compliant. So you do have to manually enter that information. And number 2, you have to upload a copy from your healthcare provider of your vaccination record, because we do go line by line to ensure that the vaccine dates that are entered are accurately reflected from your provider's record, and that also the vaccines were given per intervals recommended by the Center for Disease Control. So please remember, it's a two-step process. Once your records are uploaded, our nursing team does review them during the week, Monday through Friday, and they will respond to you if there is something that's missing through your student health portal. So remember, that's that single sign-on process. The Student Health Center does not utilize email to communicate protected health information. We use the portal because we know it's a secure method and it utilizes single sign-on. So it's good to kind of keep in mind to keep an eye out for that. Typically, you'll receive an email notification through your university email account that lets you know you have a new message in the portal. But that's how we'll communicate. For instance, if you're missing one of your measles, mumps, and rubella dosages, we'll tell you exactly what is missing per the university requirements and give you, information on how to meet those requirements. We do recommend starting on the forms early. As you can see here, I've outlined the dates on when the forms are due. So for those of you coming in August, which I'm presuming applies to all of you, the forms are due by July 15th. This is set so that we have enough time as a clinic staff to review all of the records for incoming students, so that as students start arriving on campus, we can make sure to what we call clear their record. There is a process for the university that if a newly matriculated student, first time entry into the university, does not complete their health history records requirements, and we set that July 15th as a time for you to turn the paperwork in, typically the prime line after that is that a hold will be placed on your account through the bursar's office, identifying the fact that you have not completed the health history requirements. That hold is applied 3 weeks after the start of classes in each semester. That hold can impact you when you're trying to register for classes for a subsequent semester. So just to keep in mind, we are constantly reminding students, this is often done on a weekly basis, hey, you're deficient on something, please reach out to us, reminding you to get your paperwork in. So it's something that should be at the forefront of your mind. If you're compliant, you won't hear from us at all and your records will be cleared. And you can also see that in your student portal where you'll see your vaccination information is listed there as well. So again, we encourage students to work on this early. We've started getting records in for students who are coming in this fall. And if you ever have questions, I'll mention our contact information later on. We are happy to answer any questions you may have whatsoever. We do have a process if an individual would choose to not get vaccinated or has chosen not to get vaccinated. For that information, feel free to reach out to our office. Or if it's an individual vaccine, there is a waiver process for some of the vaccines that are listed here, again, in guidance from the Centers for Disease Control. This is a paper copy of the immunization form. Again, we want you to enter this information through your student health portal, which gets uploaded so we can process it electronically. For some people, it's easier for them to take this paper copy to their healthcare provider, primary care physician, if they're seen at like an urgent care facility for those services, and have them fill in the dates on that form. The form must be signed by your healthcare provider, or if it's a health department where you receive the vaccinations at. And then this form is what you can upload as documentation of receiving the vaccines, but you still have to manually enter the dates into the portal as well. So remember, it's a two-step process. Along with the immunization information, the other two of the three required paperwork includes a tuberculosis screening form. It's a standard form that's developed from the World Health Organization that asks standard screening questions for anyone entering an institution of higher learning. It does identify students who may potentially be at higher risk of tuberculosis due to either country that they're currently coming from or due to previous work or volunteer experiences. That tuberculosis screening form is also a required form to complete upon initial matriculation to the university. If for some reason there's a question that's answered yes, which is typically indicating a positive increased risk, there are steps to take for subsequent testing that we do require, which is typically a blood test called an IGRA. Again, that's only for students who are identified at high risk based on the World Health Organization criteria. If you have questions about that form, please also reach out to us as well. And I'll again mention our contact information later on. The third form, which is really considered optional but is highly recommended, is a medical history form. This is a way for a student to let the Student Health Center know about any chronic conditions they may have, or a condition that they've been followed for by a healthcare provider. This information remains a part of your student health center records. And at any time, if you're choosing to reach out to us for care, it's information that we may need to help guide you in care and in decision making. Again, the medical history form is optional, but it's definitely highly recommended to complete as well. So talking a little bit about kind of managing chronic conditions, this is something we want to make sure students are thinking about, again, early on before they actually arrive on campus. We are here to help in the process. We want to make sure that you're aware that there are resources on campus, including Student Health Center, counseling and psychological services, disability services, and we also have campus dietitians as well. So for instance, if you have a condition that you feel may require for you to seek some input from dining services or want to talk with them, please know there are resources available on campus. We do encourage you, if you are currently on any chronic medications, to reach out to your home healthcare provider to talk about a plan of care should you become ill or should you need to seek services while you're on campus in the Richmond area. As Keisha mentioned, the Richmond area is saturated with plenty of wonderful healthcare providers and specialists. So definitely if there's something that your home provider and you talk about and you feel you need to connect with a specialist locally, we can help facilitate that for you. But we just want to make sure that you're starting to think about that process early on. The Student Health Center is part of You Are Well at University of Richmond. So this includes, as I mentioned before, counseling and psychological services, disability services, the Weinstein Center for Recreation, and we also have a health promotion department within our entire health and wellbeing unit. All of the services collectively are here to help support you during your journey here at University of Richmond. So just as a reminder, feel free to check out the You Are Well website also to find out what additional services are available that you may want to access when you're here. And finally, if you have any questions, you may email the Student Health Center. Please, we recommend not sending protected or personal health information through the email versus like a general question. You can also call us, and also on the website, again, you can access the Student Health Portal, which is a way for you to also relay information to us in a confidential manner. Again, we are, during the summer, we're here for administrative purposes. We are happy to answer questions. No question is too small. We just want to make sure we get you the right answer. Thank you.
Thank you, Dr. Lemon. So we have a couple questions that have come into the Q&A already, and I'll send those to you in a second. But for everybody who's listening or watching in, again, if you have questions, please use the Q&A function at the bottom of your screen. So Keisha, first question for you. We have somebody who's asking that they have United Healthcare in another state. Is there a benefit to enrolling in the university's health insurance?
Thanks, Andy. So I would say that first and foremost, you would need to look at the two plans and compare to see what the benefits are under the United Healthcare plan in your state versus the university's United Healthcare plan. However, in general, if you have just a standard United Healthcare plan, that is going to provide the coverage that you need here in Richmond. And also, I did not mention this during our presentation, but the student health plan in Richmond, or sponsored by the university, is also applicable across the United States. So it's a nationwide plan. So it's not just a Richmond or Virginia-based plan. It is good when you go back home or when you travel to other states or other areas. So
thanks, Keisha. Yep, that's great. Dr. Lemon, will you accept signed doctors' forms of vaccines if they don't fill out the UR form?
So it's a two-step process. You do have to manually enter the dates. We don't have a way for our computer system to process the information. So the doctor's form is fine to fill out. It could be the doctor's own form or the form, the paper copy I mentioned, but you also do have to manually go in and enter the dates, or else we can't run our compliance program for the student.
Thank you. One more for you, Dr. Lemon. Is there a TB form that's signed by the home physician?
No, the tuberculosis screening form is just filled out by the student, and then it's directly submitted in the portal. You fill it out on the portal, but it doesn't need to be signed by a provider.
Great. Keisha, I know a question that we get asked sometimes to the New Spiders inbox is about Medicaid and student health insurance. Can you talk a little bit about, if somebody has Medicaid in their home state, what they need to think about in terms of coming to Richmond?
Sure. So with Medicaid, typically Medicaid is only a state-based program and plan. And so it provides coverage in the student's home state, but it only provides emergency benefits outside of the home state. So we allow Medicaid plans to qualify someone to waive out of purchasing the student health plan, but really the person, we ask that they consider purchasing the student health plan, because if you need non-emergency care while here in Richmond, you won't have an avenue to access that. So emergencies, yes, but non-emergency care, no. Of course, you always have the student health center. So that's first and foremost. But if you need any off-campus services, you won't have access to get those, or at least you won't have financial backing to go get those services off campus. And so that's why we ask people to consider the student health plan.
Great. Thanks, Keisha. One more question for you too. I think about how people pay for the insurance. So if they enrolled in the insurance program, are they billed through the university for that, or are they billed by RMD directly?
So when you go online to enroll in the student health plan, you are not asked for any money upfront. You are billed through the university along with your tuition. So you're billed in the fall and the spring with your tuition payment. And so if you pay it with your tuition bill. If you need assistance or if you have questions or concerns about paying that additional cost for the plan, you can reach out to the financial aid office to see what additional funding sources may be available to help cover that cost.
Thanks, Keisha. Any other questions from the participants or the attendees who are with us tonight? Feel free to put those in the Q&A. We'll give it another minute or two, just in case somebody has a last minute burning question. But I want to thank Dr. Lemon and Keisha for joining us and sharing great information. What happens is that this webinar will get uploaded onto our New Spiders YouTube channel. You can find the full listing of our entire summer series on the New Spiders website, which is newspiders.richmond.edu. I am not seeing any other questions. So one more, there we go. All right, one last one. Our last question, is there any special health insurance requirements for international students? Keisha.
No special health insurance requirements other than the fact that you're automatically enrolled in our student health plan by International Ed, but no additional requirements.
Great. And I know International Ed does a great job during international orientation, talking about how to utilize the insurance and because the American healthcare system and insurance is a foreign concept for lots of folks. So I know they'll go through that in detail during orientation as well. Yeah. So I want to thank Keisha. Thank you, Dr. Lemon. I hope you all have a great rest of your evening. And thank you. Have a great night, everyone.
You too.
Thank you.